was not good news to you.
I'm thinking, like, are you crazy?
Yeah. Yeah.
I can barely function now.
Right. Right. Yeah.
I literally cry every night before I try to go to bed.
Yeah.
I'm in so much pain.
Right. Do you understand how the narcotics work? Like, how do they help your injury? Like, what do you think they
take
do?
away the pain.
Okay. Do they help heal your body too? Like, do the pain pills help heal anything?
No.
Okay.
No way. I wish.
Yeah.
I pray.
Yeah. So they're not treating the problem. So if they're not treating the problem, they're just like basically they're covering up the pain so that you can't feel it. Is that?
Yeah. Well, I mean, not as much, yeah.
Yeah, but to some extent, okay.
Right.
So if the narcotics aren't really treating the pain, then what do you know about what can treat?
Nothing. I'm going to be in pain for the rest of my life.
Okay. So no one has told you about other things that can be done to help this problem?
Physical therapy, I've tried that.
And how would physical therapy help?
I guess they were saying, like, with the range of motion, maybe. I think they also talked about surgery, but I don't want to do that. I mean, with back surgery, it can go really, really good, or it can go really, really bad, and then I'll be in pain after that, and healing. And so, I mean, that's what they said would help treat it, but...
Okay.
So, and the physical therapy didn't work, so I don't even know if I trust that a surgery will.
Yeah. And what was your experience with physical therapy? How many times did you go?
Not that many. I mean, I canceled a lot, but it wasn't helping. It made me feel worse.
Yeah, some people do feel worse in the beginning when they first start it, for sure. Yeah. Yeah,
well, I mean, and then that physical therapist, I mean, she just kept pushing me, and it's just, she didn't understand, like, I was in, it wasn't her body, so she couldn't feel it.
Right.
So.
Right.
I don't know. And that's why I canceled a lot. I didn't go that often, maybe 3 or 4 times, and I was supposed to be going like every week, but no way. My body was hurting.
Right. Right. Yeah, it's very tough, and it's very hard to understand because, we would really like to do a better job at improving pain, but when we are just using the pain pills, we get some relief, but long term they just don't work that well.
So that's why I need more now.
Yeah, because basically what happens is your body starts getting used to the pain medication. And because the more it gets used to the pain medication, inside your brain you have specific neurons or nerves in your brain that suck up that pain medication, and if they get all filled up, your body creates new ones.
So I have more pain nerves now.
Well, kind of, yeah. The parts in your brain that are like wanting that medication and wanting pain relief, like it's creating more and more. The higher the dose of the medication, the more it creates more.
Now, why the hell did they even start me on this pain meds?
Yeah, it's really frustrating. I think a lot of doctors don't know what else to do.
Okay.
They just don't know what else to do.
So what are we gonna do now?
Well, I asked you a lot of questions about what type of pain you have, because that really makes a big difference for us. Our treatment options are different depending on the type of pain that you have. A lot of people, if we x-ray their back, they can have their discs can look like there's problems in them, even though they don't have any pain at all. So just because the discs look like there's problems doesn't mean that you're necessarily going to be in pain. I understand that you're in pain, but what I'm offering is it may not be the discs alone that are causing you pain. It sounds like there's some nerve involvement when you talk about shooting pains down the legs, numbness and tingling. The good news about that is that narcotics actually don't, or opiates, the pain pills, they actually don't work that well for that type of pain. And why I'm saying that's good news is there's other medications specifically for nerve pain that could be really helpful. And the most important thing is, what I didn't hear you talk about today is muscle pain. And a lot of people don't understand that muscle pain is really, really intense, and it can really keep people from moving, and it can be really debilitating. So I think a lot of what you're talking about when you talk about stiffness or tightness or like broad bands of pain, like aching, deep aching, that's what muscle pain feels like. So the really good news about that is that can change. Muscle pain isn't, you don't damage the muscle and the muscle's just damaged forever. Muscles get stiff and tight. The thing that keeps them stiff and tight is if you keep not using them. Okay. So the more you don't work or use those muscles, the tighter and stiffer they get. And so you lose more and more mobility, and you lose more and more range of motion, like you're talking about. Like, and then, you get stuck in positions. That's why sometimes you may have noticed the more you kind of move, like first thing in the morning, the pain is the worst right after you wake up, because you've been laying still all night. Okay. And so things get tighter. Yeah. Now, I know that you didn't have great experiences with physical therapy, but one of the problems is people aren't educated properly about how it works. And you're very right that the first time or the second time or even the third or fourth time that you go, you have more pain in the beginning. But the good news is that the muscle pain in your back is something we have a lot of control over, and that could get a lot better with exercise and with the right type of therapy. So you don't have to be reliant on these meds as the only thing that makes things tolerable for you. So what I'm going to do today is talk with your doctor a little bit more about what we talked about. The other idea about like the decreasing the pain pills. The reason why that can sometimes be helpful is what we're trying to do is decrease the number of those nerve cells in your brain that want the pain medication. If we actually start to decrease it very slowly, you may be able to take lower doses of that pain medication and have it work better for you. But that's a process. It takes some time.
Yeah, that's scary.
It really does feel really scary, but it's something that we can keep talking about, because ideally we want a lower dose of medication to work better for you, and we don't want to just keep increasing and increasing and increasing, because there's other, pretty dangerous side effects from these medications as well. Okay. And they certainly make depression worse. So the other thing I'd like to talk about, not maybe today, but I'm wondering if we have the opportunity to talk a little bit more about how things are affecting you emotionally. That's not to say that your pain is coming from your feelings necessarily, but they are really connected, because the same system in your body that regulates mood and anxiety and depression also regulates pain. It's like they use the same highways. So if we start working on depression and anxiety, it's going to always help your body regulate pain better. Okay. We also know from research that people that believe they have some control over their pain, if that part of the brain starts to believe that there's things you can do to make it better, it actually controls the pain better. What you believe about your pain can actually change the levels of your pain. Okay. Even when there's a really legitimate serious medical problem going on. Okay. Do you have any questions about what we talked about today?
No, it makes a lot of sense.
Why don't I?
But I want the taper to be really, really slow.
Yeah, it'll be very slow, and we'll keep talking about things as you go through it, because we want to continue to support you through this process, and we want to make sure that while that's coming down, we're doing other things to support you. Okay. And I understand it's very scary. Yeah. I completely get that, and we understand that as well.
Okay. That sounds good.
It's really nice talking with you.
Nice meeting you.
Okay.